Hello guys, Dr. Harper here with Southeast Precision Clinic of Chiropractic, and we're going to do a series of videos on chiropractic myths, and we're going to debunk some of these that are out there that just simply aren't true, but can be very frustrating and confusing for people when they're in the market looking for alternative health care. So the first one that I want to talk about is, are chiropractors real doctors? And I hear this way more than I should, and way more than I would like to. And number one, I just want to get it out on the table that yes, we are real doctors. Number two, I want to discuss why some people may feel this way or may think this way. So traditionally in history, doctors have been a catch-all term for someone that you go to when you're sick to get medications or surgery. What we're talking about here is a traditional medical doctor. And if that is what you have in mind when you consider a doctor and what is a real doctor to you, then you're absolutely right. Chiropractors do not fall into that category. When you come to my office, you're not going to get medications, you're not going to get surgery, you're going to get a different type of care. And I'll talk a little bit about the educational component. Actually, medical doctors and chiropractors, the first 2 years of our schooling is practically identical. We both go through a 4-year program. Medical school is 4 years, chiropractic school is 4 years. And in the first 2 years, that is spent learning about the body. It's learning about anatomy, physiology, how things in the body work. Learning microbiology, biochemistry, all of those fun subjects, some of them more fun than others, admittedly. But we essentially get the same education in those first 2 years. It's just very basic knowledge of the body and how things work. As we move into the last 2 years of schooling, that's where things get a little bit different. In medical school, those last 2 years are focused heavily on pharmacology, surgical stuff, diagnosing and treating a lot of symptom-based conditions, whereas in chiropractic school, we still get diagnosis classes, we still learn about some pharmacology, a lot about nutrition. Now that's something that chiropractors get more of in school is nutrition. Medical doctors get a very, very small chunk of that in their curriculum. We get a very heavy amount of nutrition. So when you come to me, I'm going to be able to advise you more on nutritional health and natural ways to help your body out than maybe what a medical doctor would be able to. In that second half of our schooling, chiropractors focus a lot on how to adjust the spine. We first focus on how to analyze the spine and find when there's a problem and when there's not a problem. We learn how to correct those problems in the spine. And we essentially are very, very specialized in the spine and the nervous system. And that includes the brain all the way down through all the different nerves in the body. So, we do focus a lot on that because that's what we do. We also heavily focus on radiology and x-ray reading. We actually get more clinical hours studying x-rays and diagnosing x-rays than our counterparts in the medical field. It's just not something that they do on a regular basis unless you're a radiologist. Radiologist obviously gets a lot of training in that, but your general medical practitioner does not. So these are just some of the differences that I'm pointing out in the schooling. Obviously as chiropractors, we don't get trained a lot in pharmacology because we're not going to be prescribing medications. We don't do that. So there's no real need to focus on that. The same with surgery. We don't do surgery here. So that's not something we're going to get trained in. So it really just depends on what you consider a real doctor to be. And, there's all kinds of doctors out there. We have preachers that are doctors of theology. We have professors that are doctors. We have dentists that are doctors. We have doctors of physical therapy, doctors of nursing. So all sorts of doctors out there, and just because they're not the stereotypical medical doctor figure that people have in their mind does not mean that they're not educated. It doesn't mean that they haven't went to school and really specialized and focused in what they do. And that's the thing, you know, we are real doctors. We are real doctors of the spine, and we're real doctors of how to adjust it and correct what's called vertebral subluxation. And that is my primary specialty, and that's what I do. That's what I enjoy doing. And a lot of times, you know, I tell patients, I said, if I wanted to prescribe medications and do surgery, I would have gone to medical school. But that is not what I wanted to do, so I went to chiropractic school to do what I want to do. So nothing against the medical side of things. That's the other thing that chiropractors are also trained in that a lot of people don't understand is if you have a problem that is medical based or you need surgery or a medication, we are trained to understand and recognize that, and we will get you referred to the appropriate place if that's what we determine that you need. So we're not here to say we do it all, we treat it all, we're the only people that should be involved. We are very open-minded to co-management if and when that becomes a necessary thing. And I'm more than happy to send someone to a medical doctor if I feel that that's in their best interest and I feel like that's what they need. So just a little bit to clear up some of the misconceptions there behind are we real doctors, and I hope that this has been helpful in clarifying some of the things that you may have heard out there or some of the things that are floating around. So we're going to do some more of these videos on some different myths coming up, so be sure to check those out as well. Thanks.